Hey, good afternoon, everybody. It's Chris Bourne, Deputy Assistant Secretary for Innovation at HUD, and welcome to the first what will be a series of webinars and engagements providing technical assistance to EnVision centers across the country. Very excited to be here with you. Very excited and appreciative to have you engage with us, and really looking forward to working with you and with the TA providers to make the EnVision Center demonstration a success. This has been a long time coming. Those of you in particular, the sort of the originals from the original 18 from the demonstration can surely attest. It's been a long time coming to get the technical assistance out to you. And we appreciate your patience and your inputs into the process. So we've engaged with First Pick Incorporated and BCT partners to support the EnVision Center demonstration by providing technical assistance, and they've been working on webinars, they've been working on tip sheets and a newsletter and a number of other things we'll be rolling out over the coming months. We're really glad to be working with them. They both bring very unique experiences and backgrounds to the team, and we're excited to have them as partners. They have both conducted site visits. They've just before we ended up shutting down or shifting everything to telework. They had the opportunity to visit the DC Housing Authority, the EnVision Center in DC, in Bowling Green, and then through some telephone and other engagements, we're able to speak to a few others to get a good feel for what the challenges are that we can be solved with technical assistance. We've got funding to provide TA over the coming year. We've aligned additional funding to follow on after that. As we, the Office of Innovation, were tasked initially to scale up the demonstration from 18 to where we are now and beyond. And that's, we have 54 designated sites now, of which 45 of them are actually operational. So we're growing, and we intend to grow more. But we're in the process of transitioning the ongoing operations of the EnVision Center demonstration to field policy and management, who rightfully are the folks who can really turn this thing into either an ongoing initiative or hopefully a program that will continue long into the future. So we're working with Assistant Deputy Secretary Ben DiMarzo of Field Policy and Management and his team to affect that transition. And they will be picking up some of these TA tasks to include direct TA, which we're in the I know folks are hot to get that going, and we're in the process of planning that as well. So you should be hearing more about that. So with that, I think I'll turn it over to First Pick. I want to say again to all of you, thank you for being here today. Thank you for stepping forward and being part of this initiative. Now more than ever, we need to do as well as we can the delivery and the integration of the many services that are provided to Americans across the country. There's a lot of challenges out there. Anybody who's paying attention to the news knows it. Those of you who have been in the business for a while knew it to begin with, right? But we think that the EnVision Center concept, the idea of integrating the services across departments, is the way to go. And we are really excited to be working with you as you sort of in the vanguard of rolling out that process across the country. So thank you again very much, and I'll turn it back over to First Pick.
Great. Thank you, Deputy Secretary Bourne, for getting us started today. I'm Lisa Frederick with First Pick, and as you mentioned, it's one of the 2 TA providers for the EnVision Center demonstration. First Pick began working with HUD programs on training and technical assistance in 2001, and we're very excited to work with HUD on the EnVision Center demonstration now. I want to welcome everyone and thank you for joining us today. For our agenda, First, we'll share some background on the technical assistance grant to date, and Secretary Bourne also alluded to that already. We will discuss the basic topics for reopening. We know each EnVision Center is unique, serving diverse clients in different types of settings. And during the coronavirus pandemic, centers have likely been pulled in many directions, and each day is different. And all the while, you're continuing to try and meet the needs of your clients. But through this webinar, we aim to flag the common issues to consider before reopening, provide some general guidance, and outline prevention and planning measures you can take. And at the end, we'd like to hear from you. As mentioned earlier, this is kind of the kickoff to the TA that's going to go on over the next year, so we're excited to connect with all of you. So for those of you who are open to sharing, we want to hear a little bit more about your technical assistance needs moving forward. As you heard earlier, we are recording the presentation, and so we'll be sharing this out later. But with that in mind, all participants will remain on mute during that time. But please feel free to utilize the Q&A feature during the presentation. Depending on the question, it might be answered throughout the presentation or by another First Pick colleague who's on with us today as well. And then at the end, we will open the lines for program sharing. So again, as we mentioned, First Pick and BCT partners began working with HUD on the technical assistance grants for the EnVision centers in January. Our work began with some site visits to a few high-performing sites from the first cohort in order to gather information and background on the implementation process. First Pick was fortunate enough to visit both Washington, D.C. and Bowling Green in March. We had scheduled visits to Detroit, but again, as was mentioned, they were canceled due to the coronavirus. But it was evident that both EnVision centers we visited were truly invested in their communities, that the commitment to the community as well as their dedicated leadership proved to be an essential component of their success. Both sites had incredible programs and services under the 4 EnVision Center pillars. And these site visits served as an in-person introduction to us to the EnVision Center demonstration. We gained great insight from these 2 high-performing sites on their best practices, and that could help us guide the continued success of the EnVision Center demonstration. But both centers also identified areas of technical assistance that will help them to expand and serve more clients and respond to the needs of the community. So again, today's webinar is the first of 8 monthly webinars that will be coming up. The topics aim to support the implementation and success of the EnVision Center demonstration. But in addition, we are very excited to connect with all of you directly on individual TA needs. And so again, we hope to hear from you a little bit more at the end and how your centers are doing, so we can ensure kind of the individual TA needs we can respond to your individual TA needs through the direct technical assistance. So again, we know when the coronavirus hit, many of us were not prepared individually or on a large-scale response. So as EnVision centers, businesses, nonprofits have been dealing with this impact, we've all been assessing our plans to move forward. And we know there are many factors to reopening. There are considerations that are specific to each EnVision center and others that are similar to all. But I think first and foremost, knowing what the current guidance and requirements at the federal, state, and local levels are is important. We also want to look at our staff and assess their needs and concerns, how to best protect them and bring them back to in-person work. And we know you're all very familiar with your clients and their needs and what was going on prior to the coronavirus pandemic, but what are their most pressing needs now, and what are the concerns for bringing them back into the center? And finally, we'll discuss kind of the administrative and operational issues for you to consider and address. These might be changes in policies and procedures that will help you safeguard everyone as they come back into the center. So again, we know each state is in a different phase of responding and reopening. And so you should refer to your state and local governmental and health agencies for guidance. But in general, I think most guidance continues to advise that sick and vulnerable individuals remain at home. We know the information on the spread of the coronavirus continues to evolve. So when possible, individuals should continue to limit time out and limit interactions when we do go out. Always take the necessary precautions and follow any requirements about distancing and face coverings. I think we're at the point where most states and regions are at least moving towards phase 2, which generally means reopening with precautions, safety measures, and reduced capacity. We have seen non-essential travel resume, and there are less restrictions on businesses. However, the places that host the most vulnerable populations are continuing with restrictions. We know with more movement by the general public, there's an increased chance for exposure and risk. So as centers reopen, it means ensuring the necessary steps are in place to promote safe interactions and to continue to be a part of the solution. So after looking at some of the guidance, I think we want to look at what are the risk factors for both staff and clients that should be taken under consideration. Who are the staff and clients at higher risk? Some may simply fall in that category based on their age. There may be staff roles at higher risk for exposure due to the nature of the position. Are there clients that are higher risk due to their employment or occupation status? Are there folks at higher risk due to underlying health conditions? And so while being mindful of privacy, we want the planning process to account for the underlying health issues for both staff, clients, and their family members. So I think ensuring staff is healthy and safe is a top priority when bringing them back to in-person work. So how can centers continue to support their staff? I think if possible, we want to continue to promote telework. But during this time, you can also assess what your operational components of telework are, how to create an efficient, effective system that supports the team to be successful at home. However, we know much of the work of an EnVision Center is in person. You have created that one-stop shop for services. So as staff comes back to the office, be sure to demonstrate a commitment to their health and safety. Ensure that everyone understands and adheres to safety measures, provide the necessary supplies and equipment to promote safety, and evaluate processes that may create unnecessary interactions between staff and clients. We want to think about how to limit face-to-face interactions as people come back to work. And also, as individuals have been working at home, they have likely experienced an increased demand to respond to family needs, possibly around childcare or high-risk family members. So supporting your staff in the transition back by continuing to provide flexibility around these issues as much as possible. We know there will be anxiety and worry about returning to work in person, so encouraging and supporting the opportunities for staff to voice any concerns or suggestions. So if you are bringing clients back into the EnVision centers, we know there's going to be an increased need due to the impact of the COVID-19. Living through this has affected our everyday life. All of our daily interactions have changed. We have all experienced varying levels of anxiety and fear around the coronavirus. It is different from person to person and day to day, but being at home and feeling isolated has impacted everyone's well-being. Naturally, there are some individuals, like those with existing health conditions or concerns, seniors, individuals with disabilities, and children that have likely experienced higher emotional and physical distress. I think mental health is a likely concern for many of your clients under normal circumstances, but for those with existing mental health issues, living in our current situation has certainly had an impact, and it was likely more difficult to access support services around these issues. In addition, we all know the unemployment rate is at a record high, and that has left many people struggling on a daily basis. These are all some of the factors that have likely heightened clients' needs as they come in the door. So as I mentioned, seniors and those with disabilities are individuals where you may see an increased need. The isolation has likely impacted their physical and mental health. Individuals might have missed health appointments, and there was likely a decrease in their general activity. For many, that short trip out could have a positive impact on their mental and physical health. And conversely, that small change in activity can have a disproportionately negative impact. What might the priority issues be, and how can those be addressed as quickly as possible? And what might need to be in place to respond to their unique needs? Again, children are another group that might be having a harder time living in our current environment. Younger children don't fully understand what is happening. For school-age children and youth, remote learning was an option for many, but it likely did not fill the true need for learning. So what structured assistance can be provided to mitigate backsliding over the summer? Children are used to socializing at school, and they have been missing the interaction with individuals outside of their family. They're used to having more physical contact like hugging, so being sure there are measures in place to minimize issues and ensure children understand why precautions are necessary and that they follow the rules when coming back into the center. So aside from these larger groups like children and seniors, there are many subgroups with emotional, mental, and physical impacts related to the pandemic as well. And we might not be able to identify the exact impact, but having an awareness will help us in the planning and response process as these individuals come back into the center. So many who might have just been back on their feet found themselves unemployed again. Others who continued to work but knew that came with the daily risk of exposure. For those at home, many may have felt isolated if they didn't have the ability to connect with family members in person or through virtual connections if they lack the technology. These can all be things that contribute to issues and needs of those coming through the center door. So this is a good time to take stock and assess your clients. There is time to plan so you can reassess overall needs. Who and what has been most affected in these last few months? You can prioritize the needs and clients, decide what is best in person, what may continue to meet the need virtually, and assess the comfort level of all those to engage in in-person work. So as you look to reopen, you can take a look at existing partnerships and explore new ones. Many organizations are refocusing their mission during this time, and EnVision centers alone do not need to respond to every client need. So who can you collaborate with? As clients' needs may have changed, centers may need to source new partners. So for example, emergency management departments may be able to help with acquiring PPE supplies. As people start coming in, centers may discover higher needs around food security. So where are the best local resources for your clients to access those additional services? So again, as we work to reopen, it's about our clients. So again, what are their needs? How can they be prioritized? We know centers can't be everything to everyone as soon as they reopen. There are many partner organizations in your community, so be sure to maximize impact and response through that collaboration. And we know there may be a change in needs once people start coming through the door. So again, you have considered and determined the impact on both staff and clients. Next, we want to create a plan to minimize risk for staff and clients as they come back into the center. So what are new procedures and standards that should be in place? And then how do you communicate those procedures out and policies that aim to keep people safe? And most importantly, ensure that everyone adheres to the plan and its requirements once you implement it. So looking at procedures and controls, kind of see there are two general categories. Engineering, which don't really depend on the employee and the client, and administrative, which are dependent on individual behavior. Engineering controls could include plastic sneeze guards and barriers, but also ventilation and air filter systems. Being inside is you are at higher risk, so what are the ways to make the building itself lower risk? But in the immediate reopening, it's the administrative controls that are your best way to safeguard individuals, minimizing contact between clients and staff when in the center, and having basic protective measures through your policies and procedures. So what are some of the ways you can promote safety through policies and procedures? You could have staggered shifts, especially in shared work areas. So for example, could the schedule accommodate 3 days in the office and 2 days of telework? Another potential way to schedule might be based on workflow. Do certain positions depend on the work of others? So could staff be staggered according to that? In places where staff might take public transportation, could staggered staffing be adjusted to schedules that accommodate commuting and lower volume periods? Also, staggering access for clients. One way is setting schedules for various types of individuals. So for example, ensuring that seniors aren't in when children are, and trying to avoid high-risk groups crossing paths when in the center. Instituting timing and entrance standards for people, ensuring that people call for access and are not arriving early. Just being sure to have general safety requirements for everyone, like wearing a face covering, ensuring sanitizing your hands when you're entering the building, and making sure that they're followed. So through your plan, be sure you are promoting and facilitating physical distancing. How can the office be set up naturally to influence these distance pathways? Folks have been used to walking in a certain way, so how might that need to change? Much of these distance interactions are not our conditioned norms. So helping folks to naturally distance through their movements in the center is one easy way to help safeguard folks. Other ways can be made through changes to standard practices, possibly increasing phone and email communication, reducing the need for certain types of paperwork, and unnecessary contact points. And with all this planning and preparation, you want to prepare the office. Over notification through signage is best. Again, our condition norms easily return, so when individuals move through the center, remind them of the new standards and procedures through flyers and postings and through communication by phone when people set up scheduling. Have masks available for those who forget. Have increased supplies around the center, additional sanitizers and tissues. There are many touch points in an office we don't think about or didn't think about prior to this pandemic. And so having to touch the doorknob, pulling out a chair, and simple things like sharing a pen. These were all everyday mindless actions that we now want to be more mindful of. So many centers provide services in the community, and these may be additional settings that you have less control over. So being mindful and aware of those exposure points as well. Taking the necessary precautions, setting up a process that limits contact, thinking about disinfecting supplies in a way that you didn't previously, and of course, staying 6 feet apart in all of these interactions. So unfortunately, we know the pandemic has not fully run its course. And so with reopening, there are risks, and setting up the center to minimize exposure is the best plan if you are reopening, but also preparing for when and if there is exposure within a center. So developing policies that align with state requirements, and if there's a confirmed case within the center, the policies and procedures to identify that case and the possible exposure points, and any necessary reporting, and cleaning and disinfecting all those exposed areas so that you can continue to bring people back in. So with all this planning and preparation you have put into reopening, it's critical to be sure you have fully communicated this plan. We want to think about all the ways to share out information, and promoting safety cannot be shared too much. And we want to ensure that everyone understands the requirements of coming back into the center. So with that, you might want to create new written policies around hours of operation and cancellation policies. In the past, last-minute cancellations might have been looked at unfavorably, but in this case, we want to ensure that clients don't come in if there's any possibility of exposure. We can't eliminate all risk when bringing individuals back into the center, but ensuring they have the information on the policies and procedures meant to safeguard everyone is an important component. So again, we all want to get back to normal, and it's likely a different normal than before. As this pandemic is still affecting the way we operate, we can take the time to plan for safe reopening now. Again, assessing the needs, the risks, the issues around staff and clients is step one. Taking all that into account as you plan and create policies and procedures to ensure safety as much as possible. We want to communicate it out and implement. Centers that reopen need to ensure that people follow the protocols and requirements. And we know this can be difficult as you want to help your clients, but we want to keep in mind that people going out in general hasn't resulted in the increased cases. It's when people don't follow the protocols and requirements that has increased the cases. And we know we can't plan for everything, so remember, your plan can always be adjusted. So again, we know each state is different and unique, and so the COVID pandemic is continuing to evolve, and so here we just kind of wanted to highlight some of the common issues in the planning process. But really, we wanted to take this opportunity to hear from you and see where you are And again, this is a kickoff to our technical assistance. So wanted to, get feedback and have the opportunity to connect with you all. So kind of as mentioned earlier, the Office of Innovation is working with 2 providers, First Pick and BCT, on the delivery of technical assistance for the EnVision Center community. With the coronavirus pandemic, our outreach has been delayed, and this webinar really is the kickoff to the whole ongoing TA for the next year. So as we mentioned, this is the first webinar of 8 that will be presented monthly. I think in the initial flyer that was sent out, it listed the other topics, but as you can see here, these are the other 7 topics to the webinars over the next 8 months. And many of these topics correspond to the requests that the Office of Innovation received from the EnVision centers. So again, we just wanted to highlight a few of the requests that we received as part of the TA information. And so the Office of Innovation is in the process of developing the automated method for you to be able to submit your requests for TA assistance. But until that developed, requests can be emailed directly to Maria Milligan. And so I think we'll be throwing her email into the chat function right now, so you will have that as you move forward. But again, what we really want to do is to be able to hear from you and your programs today. Again, both First Pick and BCT are really excited to work with the EnVision Center demonstration sites and really help you to move forward and strengthen your programs. And as I mentioned, this is the first time where we've all been able to kind of connect with you and have you on one place. And I think it might be one of the few times you might all be on a nationwide call together. I'm not 100% sure on that. So again, we want to use this opportunity to hear from you directly. I think we have 2 representatives on the phone. I'm just going to, take a quick look and see if they're here. Unfortunately, appreciate it.
I don't believe they're on the line.
Thank you. Okay. Well, folks, sorry about. So I think if it's okay, like I said, we had seen that someone from our Washington D.C. From the Washington D.C. EnVision Center was going to try and log on, and then we also had someone from the Inkster, and I think Emily, who is new to the team, is on. Emily Human, I don't know, Jenna, if you're able to unmute her. And Emily, I don't want to fully put you on the spot, but I know I had emailed. Do you know if Mr. Paul Bollinger is able to join this call?
I believe he was going to join this call. I don't know if he actually.
Right. Okay.
I don't know if he actually made it on, but.
Okay. Great. And I don't know, I know you're new to the team. If you have, if there's anything that you and Mr. Bollinger had talked about in terms of technical assistance, if you have, again, you can just say you're not there yet, because I think he had just mentioned you started only about a week or 2 ago.
Yeah.
Okay.
Yeah, I'm not too enthused with what technical assistance we'll need yet. But I'm sure in the next couple of weeks I'll figure that out and learn a bit more about what technical assistance.
Great. Well, I think that thanks for letting me put you on the spot. So as I mentioned, we did have someone from DC and Inkster, but I don't see them on the line. So again, I do want to open the lines for anyone again. So over the next year, BCT and First Pick have been assigned the opportunity to provide direct TA to all the EnVision Center community. And again, HUD is still working out their method of how you're going to assess that or access that. And I think they're coming up with an online system so that you can submit your requests. Our initial directive is around some of these topics like capacity building, data collection, outreach and engagement, newsletters, financial capacity, some peer-to-peer opportunities, and sustainability. And again, many of those topics have kind of been turned into some of the webinars, but we know from our site visits, like I said, well, Bowling Green and DC were both very high-performing sites, and they had a lot of commonalities in order to be such wonderful EnVision centers. They also had some differences in terms of the technical assistance and support they might need to continue to grow. So if I'll take a minute to pause and just, I'd really love to open it up, and we do have our 2 colleagues from BCT also listening, so an opportunity for each of the EnVision centers to give us a little idea of kind of where you are, what kind of technical assistance is out there for you to share with us. And again, this is going to be going on over the next year or so, but as this is our first opportunity to connect with you, we'd love to just ask some programs to share. So I think the best way to do that is if through, just for background and stuff, if you're able to utilize the raise hand function through the participant list, Jana will unmute you and give you the opportunity to share out. So I'll give folks a minute to see if anyone has things they'd like to share.
Hello?
You've been unmuted.
Can you hear me?
Yes, Sergio, we can.
Hi, my name is Sergio Lott, calling from the EnVision Center, which is in Brownsville, Texas, deep down by Mexico. We are going through a resurgence, of course, of cases here in the Rio Grande Valley. We had began the reopening process of our buildings, but again, ever since Memorial Day, we have been experiencing a large surge of people that are infected. So we are slowly trying to open everything up again. Here out of the EnVision Center, obviously we have been closed to the public, but we have, I guess we've transitioned all of our services, most of our services, on an online platform. We have been purchasing different equipment to be able to broadcast live through Facebook, through Zoom, through different online platforms. So right now, I guess we are at the point where we are trying to figure out what's our best option for reopening. We were designated in February. We received our designation this year in February, and we were open for a little over 30 days before we had to close. So it's been interesting and fun, to say the least.
I bet. Well, I appreciate your sharing, and I don't know if there's anything specific. Again, I think most, all folks are kind of, there were the needs of your clients before, and COVID has probably exacerbated a lot of those, but in terms of maybe the requests that are out there, and again, being that you only had about 30 days to get going, are there, in the larger picture of TA, aside of the COVID, are there things that, technical assistance that would be helpful as you think about kind of the EnVision Center up and running in normal circumstance, whether that's around kind of the outreach to your community, or again, capacity building, or any of those kind of TA topics that are identified on the slide?
I think I was looking through the list that was sent out. Actually, I received it from our point of contact at HUD, and they all look very, very interesting. Not only that, I'm sure they would be very helpful if we were to do maybe like a go live through the webinar that you guys are presenting, maybe offer it to our residents. I work for the Housing Authority here in the city of Brownsville, and so it would be very helpful for me to be able to transmit not only for us, but through you guys, to our online platforms, maybe through Facebook Live or something. I mean, all of these would be very helpful.
Great. Well, I appreciate you sharing. Thank you.
No, of course, you're welcome.
And good luck and be safe out there.
Thank you.
Is there anyone else on the line? I also know, I think we do have some of the regional POCs from the field policy management team, and I know you guys are involved kind of on a day-to-day basis, and we've had some conversations with you about things going on, but in terms of any new information that would help, you know, in terms of TA, and you might have some feedback, so, you know, I invite those folks to speak up as well. So again, I don't think it looks like we have any other folks who have thoughts to share at the moment. Jana, do you see any other hands up?
I do not.
Okay. Okay, well, great. So I think, you know, again, we know that kind of this pandemic has hit us all, and kind of, as Sergio shared, you know, they were just getting ready and reopening and kind of have taken a step back. And I think we are all at very different places, and, you know, there's no one answer for sites. And I know kind of your top priority is probably keeping your residents safe, and a lot of the other things are kind of been on the back burner. And I think many people are operating under that as well. But, you know, we wanted to just give a quick overview of some of the information that's out there, knowing that you might be pulled in many directions and trying to kind of place things in one spot. So as I mentioned, we recorded this so that the presentation will be available on the HUD site later. But in that, the next few slides, we just included a couple of the resource links, just so you have them when the presentation is out there. So certainly there's a lot of great information out on the HUD site for PHA specifically, and for Native American programs. We also, obviously, the CDC has a lot of information out there in terms of just general cleaning, communication, and as I mentioned, we know mental health is probably a major issue that has been going around now, so there's some information there to help address some of those issues in coping during this time as well. And then there are some industry group resources and sites that have put out some resource materials for you as well. So wanted to put that in one place for you through this presentation. And we know funding is a big part of kind of being able to respond. So we know that, you know, I'm sure you're all familiar, but wanted just to kind of cite that here, is that the CARES Act provided some additional funding opportunities, both through grants and operating dollars in various areas of housing programs. And then this last site, Candid, is an organization that merged the Foundation Center and GuideStar. So I don't know how many folks have a nonprofit arm that is able to kind of access those funds, but it's a great source that has a searchable database around some of funding specific to the coronavirus, and you're able to search those sites by state as well. So again, I'm going to look and just see if any other folks have some, you know, want to raise their hand and chime in at all. If not, as I mentioned, the next and was on the flyer. Oh, I do see someone who's raised their hand. So Jana, when you have a second for that.
Okay, you're unmuted, Michael.
You can hear me?
Yes, we can.
Okay, great. I'm with a new cohort 4 EnVision Center. I'm actually the point of contact for, I guess, site for a couple in California. And we've run into the situation where we actually need more access to testing resources. And I'm just wondering if there are agencies, best practices for obtaining that. Obviously, sometimes the state and locally, the resources are in short supply. Just wondering if there's a federal best practice or source that everyone's using for their EnVision centers?
I think if there are sites on here who have found access to it, we'd love to hear from you. I think, and I have a few colleagues on, but I think right now we know that is an issue, and it is kind of, unfortunately, a state-by-state issue on some level. I don't know of any federal sources now, but it is something we can look into. And if we have additional information when we send out the link to the recording, include that information if we found anything that would be helpful. So appreciate that question. Thank you. Any other information that might be helpful or questions? Okay. Well, I don't seem to see any others. So again, our next webinar is data collection on July 28th. And the registration information for that will be sent out probably next week. We truly appreciate your time and attention today. We know with everything going on, folks are being pulled in multiple directions, and for the folks who were able to share, today, we appreciate that, and we appreciate the opportunity to connect with all of you and just introduce ourselves again. Both BCT and First Pick will slowly be reaching out and connecting with folks over TA opportunities once the Office of Innovation has solidified that. So we do look forward to meeting more of you over the next year and really getting to know the EnVision Center sites. Again, Bowling Green and Washington, D.C. were two wonderful sites that we got to meet, and we know there's many more of you out there. So we look forward to working with you. I think Enrique Shaw has, I think Enrique Shaw has a question, so I'll give Jana a moment to unmute that.
Hey, Lisa, I think it's just, he asked in the chat box.
Oh, great.
Is there a way you can provide a grant writing workshop?
Great. Thank you. Well, thank you for asking that question. Certainly, again, we wanted to get some information from you, and I think that might be incorporated into some of the other things, but we will connect with the Office of Innovation on that one as we kind of move forward and roll out the TA. So thank you. Thanks, Mindy. Okay. Well, if I don't see any other questions, I again really appreciate your time and attention today, and please everyone enjoy the rest of your afternoon and be safe and healthy. Thank you.